Yeah, I was about to say, but I do want to comment more on that too. It's the kind of support that both men and women, boys and girls, deserve, right? Not this kind of whole treating you like a princess. I think if you're rich, you probably get treated like a prince sometimes, but I just don't see it as much. But this commentary, I kind of wanted to go in a bit of a different direction here with the idea of family support. So recently, due to financial hardships of being in Minnesota, not to mention escaping the riots and stuff. Uh, yeah, my wife and I moved back to my parents' house. So this is where I'm doing this right now, right? And I think that they're being much more, you know, awesome and gracious about it than I see other family situations. Because in most cases, it seems like once you turn 18, you get basically kicked out. And, you gotta, yeah, probably not so much if you're a woman. If you're a girl who turned 18 became a woman and stuff like that, they'll probably still have the support. But when it comes to boys, you're expected to quote unquote move out of your parents' basement, and you have to be totally self-sufficient from the get-go, and you'd be basically shamed if you were living with your parents, and that's affecting that dating market too, as well. But yeah, I think that's undeserved. I think
I think you're right.
yeah, family investment should be, I'm not saying handhold your kid for the rest of your life or anything, for the rest of each other's lives or anything like that. But basically, I don't see why investment, and love, that familial love, should end when you turn 18.
No, in fact, it's a change, a 20th century change from throughout the history of human civilization. The norm was that unless you got an opportunity that took you somewhere else, if your dad was a baker, you were probably going to grow up to be a baker. You spent your whole life learning baking, and my dad followed that norm too. Um, I'm a bit of an educator. Um, I've actually worked as an educator, but not as a as a primary school teacher. I worked as a professor at a university for a while. I taught photography. But what I do with Honey Badger Radio is about education. It's about sharing information with people. Journalism is education if you're doing it correctly. You're
Right.
sharing information with people that they can apply to their lives, right? And helping them learn to understand subject matter that maybe they didn't understand before. And so that was one of the things that he passed on to me. Another thing that he passed on to me, the photography was that I've done all of my life came from my dad. He was self-taught for the most part, but from the time I was 2 years old, he put a camera in my hands,
Mhm.
and I was doing professional photography at 15. My first job, everybody else in my class was delivering newspapers and shoveling sidewalks and mowing lawns and babysitting other people's kids, and I was covering football for the local newspaper and going to weddings with my parents and contributing to the wedding books and so on. Um, and I like the kids that I went to school with were divided into two camps. You had kids like I just described that were doing all those other jobs, and then when they turned 16, they went to work at like McDonald's or Kroger.
Yeah.
Well, I guess it wasn't Kroger that we had Kmart, but
Yeah.
um,
Yeah.
but yeah, places like that. And then you had the kids who grew up on farms, and those kids had jobs from the time they were two. They started out gathering the eggs from the chickens. Come with
Yeah.
mommy, take this basket, we're going to pick up the eggs. And those kids, they worked all their lives. There was not a time in their lives when they could remember that there weren't jobs to do. And they they learned to be farmers. And one of the boys in my class, I know for sure, his father was a very successful wheat farmer.
Mhm.
When he graduated, his graduation gift was a small farm near where his father lived.
Right.
Like, he got a farm for graduation, and he did go to school for a little bit. He went for horticulture to pick up some more information that, it's easier to learn in a university setting than on the job. But I don't think that he wasn't like the other kids that had to go get a 4-year degree in order to get a job. He had one built in. And it used to be, centuries ago, that's the way everybody lived. You did what your parents did. And if you wanted to do something else, you had to find somebody to take you on as an apprentice. And, you had to go someplace else. So it was pretty normal for families to stay in the same neighborhood, stay close to each other. People didn't move far away. And a lot of times you would have great-grandparents and parents, grandparents and parents and children all living in the same house. And other cultures besides, the Western European culture, other cultures did that as well. The Mohawk had a thing called a longhouse, and you had your extended family in your longhouse. It wasn't something that, it wasn't like the teepee. It was a big, long house. And we ended up learning about that. My son and I, we started doing a little research because that's part of our ancestry. And his school system does the PC thing with they've got a Native American theme for their school, their mascot and everything, right? So they went with this whole tribe motif, and they had the students learn a lot about the history of the tribes and the way they lived and everything, and they wanted him to make a wigwam. And so we did, and then we also made a longhouse for him to take to school and show the difference and what the cultural differences in the different tribes were between people who lived in one and lived in the other. But so this is, when I started learning about that, I thought, well, that's an interesting thing, because my family just kind of automatically did that. My grandparents came to live with my parents when I was in high school. And when I was in trouble, my son and I lived with my parents, and my husband came and stayed with us as much as he could while we were trying to get our feet on the ground and get ourselves a place to stay. And, so it was normal, I guess you could say, in our family. But I know a lot of people have that issue of, you boot the kid out. Yeah. And, it's just, now I'm at the mother and grandmother end of it. And my husband and I became empty nesters during the COVID crisis because my parents were still in the home that I grew up in. And we had to move to the Dayton area. We were like 80 miles away. And my son was worried about them. And I didn't want him in Dayton because we're both asthmatics. And I didn't want him to we didn't know how COVID was going to affect asthmatics. So I'm like, well, you can stay with Grandma and Grandpa. And he was like, yeah, I can go take care of Grandma and Grandpa. And I hadn't even been thinking of it that way because he had just gotten out of high school, right? I'm like, oh, yeah, you can go stay with Grandma and Grandpa. Oh, I can go take care of Grandma and Grandpa. And he looked at it that way, and he did. He took care of them until they were gone. But it was just, that's how things were. But it just all of a sudden hit me that none of the kids are at home anymore. And, I kind of waited until nobody was around and just bawled my eyes out.
Yeah.
Because, my babies are gone.
Right.
And my mom did that, when I moved, every time I moved out and I moved back. I moved back home twice. So I moved out 3 times. And I went to college, so I moved out 4 times.
Right.
And my mom, every single time, it was like ripping her heart out, and I didn't get it. I was just like, it's gonna be okay. I'm still gonna come here, and we have phones. You can come and see me. It's not the end of. I'm not going to Australia, and everything. And now I know, and I don't understand how parents kick their kids out at 18.
Well,
I don't get it.
Yeah. Now that I've been thinking about this, I don't get it either. But I had a friend. I'm not going to name a name, but he went back and forth between his mother and his parents were divorced, of course, and back and forth to his mother, and his dad with his stepmother there, right? And he was about to be kicked out of the father and stepmother's house, right? Because they told him that well, they're going to move out of the house, so we're going, so you better get out. And so he did. Right? He left and went on his own. But then it turns out that the dad and the stepmother never left. He just wanted him out of that. Yeah, right. They never moved anywhere. It was just a ruse to get him out of the house.
That's got to be the stepmother's idea. I just can't imagine that
It
dad
had to
came up
be.
with that.
Well, with him, based on what I know about him, you'll never know. I mean, I'm pretty sure both of them could have been a part of it, but yeah, it's like this idea of like stopping love at a certain age is mind-boggling now that I've been thinking about it the past year or two.
Yeah.
It's a shame that it's the norm, right?
Yeah, it is, and it's kind of dumb too from the perspective of like what happens when you get old.
Right.
Like my parents were unusual. They my dad worked. He had. I'm going to go backwards on this a little bit.
Sure.
So my dad had his first heart attack in 2012. He had his third heart attack in 2015, and a pacemaker was put in. Not a pacemaker, I'm sorry, a defibrillator.
Right.
So he was in pretty bad health after his first heart attack. He needed he had a quintuple blockage, but they were only able to do a quadruple bypass, and they said his heart was at 25% effectiveness. So that's a situation under which most people would become disabled. He continued to work until the university that he was doing photography for their sports information program had to close the campus to anyone who did not live on campus or teach there or was part of the janitorial staff. So they didn't have anybody doing any, like, contractors didn't come on there for anything that was non-essential, and they considered photography non-essential. And that was the only reason why he stopped working before he passed away. He would have been working right up to the day that he went into the hospital otherwise, because he worked the day that he went into the hospital for his heart attack. The night before, he worked, and the way his heart attack was, he was in congestive heart failure for a couple of days before he actually went to the hospital, right? Yeah. And I just, with my dad and my mom, that's just the way they lived. My mom was like that as well, right? A lot of people go into nursing homes, or they move in with their children. We never got the living circumstance. If we were going to do something like that, we would have had to move back in with mom and dad to take care of them. We're in an apartment, or we'd have had to get a house down here, which we were talking about doing. But most people, at some point in their lives, they stop being able to take care of themselves, and they need other people to take care of them, just like they did when they were kids. And I mean, I've worked in nursing homes, and there is a very stark division between two sets of people in nursing homes. There are people who have family members or other people who care very deeply about them, close friends. Sometimes it's the students of a teacher, if the teacher didn't have any kids, that come in and visit and check on them and, sort of check up on how the medical staff is treating them and everything. And then there are people that never see a visitor after they walk through those doors. And those people that never see a visitor after they walk in those doors, a lot of them are people who either don't have family that's younger than them, like they didn't have kids, they didn't get married, whatever, or they've alienated their family members. And I think kicking your kids out of the house at 18 is a very bad plan for how your life is going to be in your old age. Even if you didn't have how much you care about your children and how much you want them to care about you and all that, people who are selfish enough to just kick their kids out without any consideration and stuff like that, are stupid, in my opinion.
Would you say that uh, being stuck in the nursing home and basically kind of becoming alienated, like not having a visitor, do you think that actually exacerbates any kind of mental condition that they might have in
Oh
their
yeah,
old age? Yeah.
there is there's a syndrome when you're in a medical facility, um, and it's usually you see it in hospitals. It's hospital-induced delirium, and it includes paranoia and hallucinations, depression, a sense of combativeness. Like you start to just feel like everybody's in there to be mean to you. And in a hospital setting, it's usually a temporary experience. But the older you are, like if you already have a little bit of loss of cognitive function, your memory's just not as fast as it was. You're not quick with the vocabulary words, or you can't remember where you left your car keys, or you call things or people by the wrong names sometimes because your
Right.
brain is just a little slower at retrieving that information. Um, Hospital-induced delirium can speed that up, and you can start to appear to be experiencing age-related dementia when in fact you're just experiencing facility induced cognitive damage. And I had patients that I saw dealing with that, and there are things that can be done to affect it. Like there was a lady years ago that I took care of that they thought she had deteriorated to the point where she just parroted things back if you said them to her.
Ah, I see.
And
I see.
she couldn't have a conversation, and she couldn't tell you how she felt or any other information about herself. Like you say, how you feeling today? She's not going to say, my back really hurts today. None of that. You kind of had to pay attention to the expression on her face, and if she was holding her hand up against her hip, or something like that, and you're like, okay, then she might be experiencing some discomfort, and you move her and that kind of thing. Well, it's pretty clear throughout this conversation I'm a chatterbox. Um, so, I
No, that's all right. Like this is the
go
kind of
into
organic
right?
sort of conversation that I try to seek out.
Well, that's good. That's good. But I'd go into this woman's room and I'd just talk to her like you would talk to anybody else. It's just she wasn't going to answer me back, right?
Hmm.
Well, then one day I went into her room and, and I greeted her, hi, Mrs. Name, how you doing? And she goes, hungry as a bear. And I was like, what? you, you just answered me. I went and got the nurse, and nurse
Yeah.
came in, and I'm like,
Hmm.
watch this. And I said, well, how you doing today? And she goes, I told you I'm hungry.
Hmm.
And the nurse just about dropped her teeth.
Oh.
And that was my first experience with bringing somebody out of,
Mm.
that facility induced cognitive loss. And she goes, what'd you do? I was like, I don't know. I just come in here and I take care of her and I chatter at her. And she's like, you talk to her? And I was like, well, yeah.
Yeah.
Like, doesn't everybody just talk to her? No, nobody talks to her because all she does is parrot it back all day. I'm like, well, now she's going to talk.
So
And
it almost seems. Go ahead. Go ahead. Sorry.
that was my first experience also figuring out that I think a lot of things in the medical facility or in medical community that don't get done, people don't think about the impact of the silent treatment, or they don't think about the impact of rough handling or failing to ask consent. Like, Mr.
Mm.
Name, I'd like to help you get changed. Can I help you take your shirt off? Can prevent Mr. Name from punching the young lady across the room that's trying to strip him without
Right.
warning.
Exactly.
And like a lot of people working in nursing care don't consider those things.
Mm.
And
It's like
yeah, that makes a big difference.
it's like you can organically reverse some problems
Hmm.
in these very subtle ways. These things that don't require a terrible amount of thought. You just kind of do it as if otherwise nothing is wrong, and kind of can bring him back into the real world, I suppose.
Yeah, there's this thing that happens in medicine that I've seen it at medical facilities where I've been a patient, and I've seen it at medical facilities where I've been a practitioner. I've always been the lowest level, nurse's aide. I'm a direct support professional for intellectually disabled adults now. So you get 2 weeks of training for that. I can do med passes and first aid, right? And I've seen it at places where I'm a family member there as a caregiver for somebody who is in treatment. And so I've observed from everything except in the high level practitioner and administrator position, and it's you forget as a practitioner that what you're dealing with in terms of your job duties is a person and not a set of tasks and to be done and problems to be solved.
Yeah.
And we get very clinical in the way we handle things a lot of the time, and you can't separate medical treatment from caregiving. If you separate medical treatment from caregiving, you lose the person and you end up with all of this the cognitive loss, the depression, it's very demoralizing to be treated like really genuinely treated like an object, to be
Right.
handled and managed and a problem to be solved, instead of a person who has a problem that they need help with.
Yeah,
Does that make
absolutely.
sense?
Yeah. Oh, it does. Yes. Like I was just thinking about this whole idea of detachment from the patient, right? Like that's something I commonly hear in like medical contexts, but I think it's taking it a bit too far. Uh, this detachment, I think.
Yeah, you have to have a balance,
Yeah.
right? You have to respect the patient's boundaries, obviously, and you have to be able to not let, like, the fact of the matter is, with medicine, most of the time you're dealing with human suffering, and if you spend your whole day observing and confronting human suffering, it gets painful. So you have to have your own boundaries for that.
Right.
But there's a level of care that you can engage in, and a method of care that you can engage in, that allows you to focus on the person and focus on alleviating what suffering you can alleviate, and being able to give your compassion and be patient with the patient and everything else, without when you walk out of that room carrying all of that pain and suffering with you. And there's some things that you just can't, like, I've lost patients. When you work in a nursing home, people are going to die. They're
Right.
gonna, at some point, they're gonna hit the end of their lifespan, and there's people choose not to, they choose not to be resuscitated. There are people that have DNR orders, do not resuscitate orders, and people choose not to have procedures done and stuff because, what is this going to lengthen my life? Is this just going to make me hurt for the rest of my life? That kind of thing. And it can be very stressful and painful to see somebody going through that, but you kind of have to work through that, or maybe go work in a factory instead. Like, there are people that are that need to be working in medicine and should be working in medicine, and there are people that aren't cut out for medicine and are going to be really good at something else and should be doing that. And nobody should be shoved into medicine if that's something that is going to slowly kill them.
Right. Yeah, thanks for thoughts on those. It's quite a lot to think about.
I think that actually goes back to the abortion issue too, because
It does. Yeah, I was thinking about how detached one is from the idea of a fetus as a life form, as a like something on the trajectory of becoming an individual.
Yeah. My dad, and I refer to him a lot. You know, can't help it.
Yeah, yeah,
Like I
of
learned
course.
so much from him. Um, but gosh, that's still raw. He had a lesson that he would give on the self injury of having a racist attitude in his classroom.
Okay.
And so he asked the kids, you know, to picture this. Imagine if the first thing that you were required to do every morning when you got up, you know, before you go and have your breakfast, you have to go into a room with a basin of water and drown a little baby kitten before you can do anything else.
Right.
And you know, immediately all the
Mm.
kids are just like horrified at this idea.
Yeah.
And he's like, imagine if throughout your day, every day, you know that when you get up the next morning, the first thing you have to do before you can do anything else the rest of the day is drown that little baby kitten. And you have to watch it struggle and suffocate under the water and die in your hands. And, you know, the kids are all just like, why are you talking to us about this? And he goes, think about what you would have to change in yourself, how you'd have to harden the inside of your psyche, how you'd have to make your heart less compassionate, and how you'd have to draw a division between yourself and that kitten, and not think of it as a cute little baby kitten that's alive and cuddly and has experiences. And you'd have to change your brain. You'd have to become a different type of person, and you'd have to kill some things within yourself in order to do that and be able to live with that all of your life. And the kids were just, you know, you could see him being demoralized. And he's like, imagine, you know, you'd have to have that kind of hardness and develop that level of naturalized meanness within yourself to look at a sweet, innocent little kid and call that sweet, innocent little kid a racial slur, and watch their face fall and watch
Right.
them, their shoulders slump, and they turn around and walk away from you, right? And he goes, that's why when Martin Luther King rallied people to march for civil rights for black people, he wasn't just freeing them, he was freeing everybody, because nobody has to live in a society where they are expected to be that hard person that's ugly inside and has to do mean things and be, you know, uncompassionate and think of a whole set of people as not being as much people as themselves. And I kind of feel like when you have a profession of people that have to, as every day, go to work and pretend that killing babies is a medical procedure, they have to do those same things. They have to
Right.
change their hearts and their minds in such a way as to take away from themselves something that is fundamental to our humanity. You know, the psychological part of our humanity. Like, they're still human beings. They still have human DNA. They still are living. They're still everything that any other, but they're wounded psychologically
Yeah.
by that. And every person that works in that facility has to be changed in that way in order to maintain that job and live with themselves. And I would think it would be the same kind of changes that you would have to be on the bad guy side of a war, right?
Right.
And except in this instance, it's a war on the next generation. And I think getting rid of the incidence of abortion, having abortion reduce an incidence to the degree that there's just not enough demand to support the industry, would
Right.
free a lot of people. Because, like, when I go to work and I do my job, I don't have to do that. I don't have to harden myself against things that I do at work. In fact, I open myself to things that I do at work. I'm helping to make people's days normal where they would, if they didn't have any help, have a very bad day in every day.
Yeah.
And so I get benefits from that. And, if I worked in a plant that made car parts, every time I saw somebody drive by in a car that had that kind of parts, I could be like, I helped make that,
Yeah.
and I would have a sense of accomplishment from that. But what do you get in terms of a sense of accomplishment when your job is killing other people's babies?
It's
There's no. I think there needs to be increased value placed on the fact that someone is going to come into being.
Mm-hmm.
Right? That's the best way I can put it. Like that in itself has to have value. In fact, that's the way I've kind of tried to contextualize this thing during my, shall we say, transition from the pro-choice side to more the anti-abortion side. That's the way I was kind of trying to form this idea of value of what is potentially, even though not yet, it will be a living individual, and it's on its natural trajectory into being, and it should be maintained and at least guarded as such.
do you see where I'm
Right,
coming from
nurtured.
here? Yeah. Right.
Yeah.
Right.
Right. I think that's the mentality that
Should be more proliferated, pro-life, proliferated,
Yep.
pro-life.
Yep.
I play Magic the Gathering. Proliferate's a function, and I see that term all the time. It's like pro-life.
Yeah.
Sorry, weird tangent, but
No, I understand, because I got out of Magic the Gathering in the 90s because of the card flood. I was like, I got frustrated, and I'm like, all right, I'm done with this. But I'm not buying another $500 worth of cards next week. I'm not getting a second job to feed my card habit. But I understand the cards and the card features and everything because of that. So I know what you're talking about. I get a little obsessive with games. Like when I play video games, and I haven't had time to do that in the last probably 6 or 7 years. But when I play video games, I have to set an alarm for when to stop, or I will discover that I've been playing for 12 hours and nothing is done, and I haven't eaten anything all day.
Right.
And like I started buying Magic the Gathering because I liked the artwork. I saw the cards and I'm like, oh, those are really cool. And I was already buying oh gosh, what was his name? I still have the cards, but I haven't put them away because of where we are. A surreal artist. I found his cards in a comic book shop, which I was in there to see. They had used comics, and I had always I never bought new comics. I always bought comics that were like not collectible comics. There's collectible comics and there's used comics. The comics I bought were Hammer's House of Horror. Back in the day, they were used comics. They weren't collectible at the time. And I was looking to see if they had any, and I get in there, and there's Jim Warren is his name, and I get these art cards, and they're just fabulous. And then I went into Walden Books, and they had cards, and I'm like, oh, do they have any Jim Warren cards? And I'm looking, and I was like, well, no, but they have this, and it's really neat. And that's how I ended up getting into Magic the Gathering. But yeah, that little aside. And then I ended up feeding my Magic the Gathering habit for several years before I like, okay, I can't afford this anymore. I'm done.
Yeah, well, it's it's pretty it's still ongoing, and it's the one game that I've got enough friends that play with. It's something I've been pretty serious about trying to make the best deck, because right now there's a format called Commander that I'm really into. That's really popular. Almost everyone plays Commander, and so I've been kind of setting aside a bit of money, kind of like how you're setting aside like
a time frame,
time slot,
time slot.
Yeah, I'm setting aside a bit of a budget and some time to play, but I keep busy. I mean, I do interviews like this. I try to record my own music. I have a day job, and and I obviously spend time with my family and my wife and everything. Everything in its place, but I don't want to deny myself any kind of pleasure. And I think a big men's issue is the fact that they're expected to deny themselves pleasure for being a man, I think.
It's
Uh,
very important that you don't do that, because
Uh-huh.
if you deny yourself that, you end up, that saying, all work and no play makes Jack a dull boy.
Right.
Well, it's totally wrong. All work and no play makes Jack have a heart attack.
Uh-huh.
And
Yeah.
then the other thing that can happen is it makes Jack very depressed, and we all know the suicide rate. It can make Jack totally nuts. It makes him anything but dull.
Right.
It's everything about it is bad.
Sure, yeah. It's a big criticism I have on what I think are the conservative sides this time around.
Yeah.
Because they're on about, stop playing video games, get out of your mother's basement or something like that. As if that's the stereotype, right?
Right.
And yeah, and so, and, and it seems like, a lot of women seem downright turned off by the fact that a guy has a hobby,
Yeah.
and he wants to spend a lot of time in it. He's not spending his existence servicing womankind.
Yeah. See, this is another one that's my family was. I don't know, maybe we were aliens or something. My parents had an attitude about the progression between adolescence and adulthood, where this is a prep time, right? Like, they're both teachers, so one of the things that teachers have, you have homeroom at the beginning of the day, in like from, I think, middle school on up, where you're changing classes. Homeroom is the teacher's prep period, where they get things ready. This is what I'm going to do today in school. I want to have my materials. I want to have the right lesson plan sitting out, and so on. So the plan, when I was getting ready and when my brother was getting ready to move out of the house, in our adolescence, wasn't, here's your end date, here's your deadline. It was, you're not married yet, so there isn't any reason why you have to go pay for an apartment somewhere. You still have a room here. We're not short of space, and we're still your parents, and we're still here to guide you. If you get a job, we think you should build up some equipment, the stuff that you're going to use for the things that you want to do, or put some money aside to pay for a living space.
Yeah.
And so when I left to move out of the home, I had a full set of equipment to do my photography. And when my brother moved out, he had a full set of musical instruments. He plays 7 different instruments, and he sings, he writes his songs and everything, and teaches guitar. And he had multiple guitars. He had a keyboard. He had an electronic drum set. He had a saxophone, a violin, a banjo, harmonicas, just like all that stuff. And he had a band, actually had 2 bands. Mm-hmm. And they played out, because he had one band that was a blues band, and then he had another band that was sort of a everything band, like a wedding band.
Yeah.
It's like, I don't know if what it's like everywhere else, but you go to a wedding in Ohio, you are going to hear a series of songs in a row that starts out with polka, goes through rap, heavy metal, and country music, and right, ends at a folk song from the 1920s. Mm-hmm. So, and that's just like, I think that's just America. We're so multicultural here that the music, yeah. But in any case, like, that's the way we were taught. Like, all right, you're in a situation where you don't have bills, but you have income. That's when you should start investing. It doesn't mean that you have to get out of that situation right away. The adult thing to do is to be mindful of how you use your resources and maybe store up for later. And, right, obviously there was the stipulation, like when I lived with my parents, I did a lot of the cooking and cleaning, and I contributed to the grocery bills. I had to do so surreptitiously sometimes because they wouldn't take the money, but I did.
Yeah, right.
And, just stuff like that.
Yeah. Which reminds me, I'm not staying here. We aren't staying here for free either. There's a bit of a electric bill rant. That's.
I figured.
It's good. We talked about that because I need to be reminded of it, so I can take care of it today.
I know exactly what you mean. It used to be you used to get a thing in the mail, and everything's gone paperless, and now I have an alarm on my phone that goes off every month to remind me to look for the electric bill in my email so that I know how much I owe. But modern technology makes everything less complicated. But yeah.